healthcare units with its own lab, pathology lab, and also pharmacy units. And again, most of them are not linked. Right now, it is not integrated. They will have a separate lab. The doctor has to write a separate prescription. They give it to the lab. Then they do all the reports. Again, we have to go and collect a physical copy of it. Again, give it back to the doctors for the diagnosis. But what if this whole process can be digitized in such a way that the moment I have a appointment, if at all there needs to be a laboratory test that I need to undergo, the doctor prescribes it, and that goes straight away to the pathology lab, and I don't need to carry a appointment, or I need to take a printout what test it is or anything as such. And then they check it and they do the testing and they update the records then and there itself with the results, so that I get to know that, basically what are the samples collected, and they get to know the result, and it's logged in there itself, so that the doctor can also access it and later take it up for further prescription. And that is one. Coming to the prescription again, once the doctor prescribes me, that goes straight away to the pharmacy. They check the stock. They, based on my requirement as a patient, they issue the stock for me, and then they issue the bill. So all this put together with one patient can be put out together. That is, the lab need not give me another one invoice separate. The pharmacy need not give me a separate invoice, and the doctor need not give me a separate invoice. Everything can be put out into one patient record and can be an integrated solution. As I said, starting from lab request tracking to alerts. If at all there is something goes abnormal with my results, so that has to be also put out as a alert and notification. And then for the pharmacy people, they can clearly have an inventory module itself, where they purchase purchase all the materials that they require. They issue the goods to all the, they sell all the medication, and it could be various things to the hospital or also to the patients. As I said, you can see the records over here. A couple of screenshots. What are the lab tests, where we can have certain lab tests put out in Odoo itself. That is the blood count, and who is the patient name, who is the physician, what are the different things that they see. That is, you can see the hemoglobin, RBC, MCH, MCHC, and other medical terms put out over there. I'm sorry. So, and the results put out recorded in Odoo itself. And then what is exactly required? For example, that is, if at all they take X-ray scans, or if they do MRI scans, what is the result? They want to put out images as well. The records that you see, the records that you maintain physically, can be attached in Odoo itself. As a PDF or as an image or as a Word document, anything can happen, and so that it stays as a record digitally as well. So basically what happens, as I say, we feel that when diagnostics and drugs are disconnected, the patient's care gets compromised. That is, we feel that because of this disconnected workflow, the patient has to run between the departments or run from one aspect to another aspect, maintaining all the records, with already so much of things going on with their own health, which is more of concern. Maintaining these documents, putting up the bills, putting up the registrations, getting to go to each and every department makes their psychological workload increasing. So that is where we want to address, so that these things can be digitized and make it even more efficient, both for the patient and for the healthcare sector.